As we approach the back-to-school season, it's also National Immunization Month. To help us understand the importance of vaccinations and what parents need to know, we're joined on this Mindful Monday by Mayo Clinic Health System resident physician, Dr. Rachel Leonard. Thank you for being here. Good morning.
Good morning.
So just tell us a little bit, why is National Immunization Month so important, especially as we are getting ready to send the kids back to school?
Yeah, that's a great question. I think for one thing, you know, when your kids go back to school, there's a lot you can't protect them from, right?
Yeah.
Scraped knees, bumping noggins, but you can give them vaccines, and that helps prevent from a lot of viral illness that can be, you know, make them very sick and can even be life-threatening.
Yes, we know kids are always picking something up at school,
Yes.
so
Yes.
The more protection, the better.
Right. What are some of the key immunizations that the parents are going to be needing for their children this year?
So a lot of that depends on age, and the CDC actually has a really good website that kind of depicts these vaccines for parents if they want to review on their own too. But you know, for younger kids, you definitely want to be having the MMR for like measles, mumps, things like the polio vaccine. Also, are like viral illnesses, RSV, flu, COVID, also important.
Okay, all the basics
All
there.
the basics plus COVID, right?
Yeah, any changes or new vaccinations that are being recommended this year?
Not really. There haven't been many changes. We just still continue to recommend flu and COVID vaccine. And then there's been a little bit of an uprise for the RSV vaccine, but there's still some things that we're working out with that.
Yes.
What about adults? Do they need immunizations going back to work?
I don't think they need an additional, but we kind of recommend some of those same vaccines for them as well. So for adults, RSV is actually a new possibility, kind of depending on your age and other health conditions. But flu and COVID are very essential too, right? Because we're going to be in enclosed spaces once again, as we already have been, and that's a good opportunity to spread viral illness.
Right.
And we are seeing an uptick of COVID right now, right?
Absolutely.
So good idea. I know sometimes we report you should try to get that COVID and flu vaccine by October. Is that something that you recommend too?
Yeah, so we generally kind of time it on when the peak viral season is going to be here. So for our recommendations, I think too, classically the vaccine, you kind of have peak effectiveness over the 6-month window, so you try and capture the time when one is most likely to get the illness.
And long COVID's associated with that as well?
So yes, you certainly can. Unfortunately, we don't have a clear understanding as for why some people get long COVID, but the better you protect yourself and don't get COVID in the first place would be a great step.
Yeah, for sure. And so
Yeah.
we've seen, you know, a lot of anti-vaccine rhetoric kind of coming up lately, leading to some parents, you know, being hesitant or maybe choosing to not get their kids vaccinated. What is your message to parents who are hesitant?
Yeah, I think it opens the door for a conversation with your doctor, right? My only prerogative as a physician is the well-being of your children and the well-being of you. As a family doctor, right, I see people of all ages, and so I think all care is shared decision making, and so what we want to do is just have that conversation because we can offer information that may not be available to them.
Okay, so if parents are hesitant, just talk to your doctor would be the
Talk to
first
your
step.
doctor. All we want to do is help.
Great, good to know. Okay, anything else parents should know, you know, about the virus season or heading back to school, vaccines, any other message you want to share?
Yeah, in addition to getting your vaccines, hand washing is extremely important. It's often overlooked, but it can go a long way in helping prevent some of this illness too. And then, yeah, just know that these are very safe, effective, and well-tested things. So there really is no harm. There can only be good benefit.
Okay, great. And then speaking of hand washing, you know, I know hand sanitizer is so easy, especially if you got little kids. I know sometimes it's easy to reach for that, but I have read that there are some illnesses that hand sanitizer doesn't kill, right? So you want to make sure you're getting the real hand washing in there too, is that right?
Yeah, I think so. I mean, if you're going to use hand sanitizer, it's probably better than nothing.
Better than nothing, right.
But if you can kind of implement some hand washing in between, I think that would go a long way too, just for those 0.1% of bugs that aren't going to get caught.
killed,
Used to do
right.
both at the same time.
Those are the bugs that always seem to sneak their way into my son's daycare.
Absolutely, as it goes.
Yes. All right. Well, thank you so much for being here this morning with us, Dr. Rachel Leonard.
Absolutely, my pleasure.
All right. Stay with us. We're back right after this.